I recognize the senior officers from the ministry, of course, and from the county government. Waziriganda, you together with your team, thank you very much. Our development partners from the ministry and those working within the county of Kisumu, and especially Farm Access. And I know that the global director has spoken here, and there's Millicent Olilo, who is also here. We have had a long working relationship with her. I saw Natalie. We've had a very, very long working relationship with them within this space. I also want to recognize the health workers of the county of Kisumu, and especially the community health promoters. Jiduto mobiro, jokoloa maugwe, koloa east. Amosu duto na Nyasaye be. Sechete. Akelo nu mos mar gavana ukao. Ukao mos mar ngiri. En Amerika fuane unuone kumaentie no kuro wako mos ne adier. So I'm honored to join you here at Angola Health Center today for the official launch of the Kenya Quality Model for Health Plus. This activity emphasizes the fact that every Kenyan, wherever they live, deserves safe, effective, respectful healthcare. Such healthcare has to be of acceptable quality and safety as a right and not as a privilege. Now, Kenya Quality Model for Health Plus is therefore very timely. It strengthens the use of data, digital tools, learning, accountability, and to a large extent, it is in tandem with the aspirations here in the county. And we are fully aligned with the national health reforms and the universal health coverage agenda. Now, in Kisumu, we understood early that quality improvement cannot stand on weak foundations. And that's why I also want to thank Make Me Smile, my very good friend, Dr. Simon Peter. I remember when we assumed office in 2017, this was one of our first stops. And I am happy, Simon, that the governor and his team has not let you down. I also want at this point to acknowledge the very close working relationship that the county has had with KMET. Dr. Monica Ogutu, you stand out because in every endeavor that we've had, you've worked very closely with the county, and most of the achievements, I must say, has the footprint of KMET, and indeed the many other partners we've had. Now, that's why we first invested in infrastructure, utilities, service readiness, and digital systems, especially within our primary healthcare network hubs. Now, to give you a glimpse of the track we have trodden on this journey, ladies and gentlemen, in Moroni County Hospital, we fully restored infrastructure, refurbished wards, improved water and sanitation, and enhanced lighting for 24-hour services. Moroni is now a dignified referral facility within Moroni Subcounty. At Lumumba County Hospital, where Dr. Monica Ogutu chairs the board, we reorganized services for efficiency and achieve full digitization using Taifa Care. Nurses can now use digital photographs that flag complications in real time, therefore saving lives. At Ojola Sub-County Hospital in Kisumu West, we revamped the OPD and established a wellness center that provides preventive screening across the course of life. In Nyakai Sub-County, at Katito Sub-County Hospital, we combined structural upgrades with solar power, Wi-Fi, and CCTV. Katito is now a 24-hour digitally ready facility. At Ahero in Nyando Sub-County, we upgraded the maternity, the mortuary, the power supply, and the digital connectivity, linking the hospital to real-time county supervision. In Gita and Kombewa, Gita is in Kisumu East and Kombewa is in Seme. We refurbished facilities, expanded maternity and theater capacity, and deployed specialist teams closer to our people. Now, these investments, ladies and gentlemen, were very strategic. They have helped in laying down the groundwork for quality, because quality must be established on systems that work. Further, As we strengthen these systems, we are strengthening our health workforce. I am pleased to report that the County Executive Committee has approved the recruitment of additional healthcare workers. The positions will be advertised next month to improve responsiveness, reduce the workload, and strengthen care, especially in maternity, outpatient, and emergency services. Kwa hivyo wale ambao wako na cheti, those who are qualified can look out for the adverts and they can apply, for those positions. Here in Kisumu, Madam PS, ladies and gentlemen, we made a deliberate decision that quality improvement is not an event. It must be embedded in our daily work. Now, through our Safe Mama Tech, we deploy digital tools to identify high-risk mothers early, support clinical decision-making, and reduce delays in care. Now, these interventions are linked to our Emergency Operations Center, supported by ambulances operating 24 hours a day, 7 days a week, and are free of charge to the citizens within the County of Kisumu. We are happy because the results speak to themselves. Here in Kolua East, for example, all mothers who have passed through the Safe Mama Tech program have had very good outcomes. And Madam PS, nothing warms my heart as a leader than to hear, such stories. And I want to thank Otuge Mawodahala, Council Otuge. For Otuge, to say you have done a good job. Hey, you have done exemplary. Yeah, because I know him. He sees things in black and white. Kama ni mbaya, mbaya. Kama ni mzuri, ni mzuri. Kwa hivyo Otuge, kama umesema tumefanya kazi mzuri, sasa wewe ni nani unasema ni mbaya? Otuge, asante sana. And that is not just here alone. That was at the center. And, that is his experience, and he's a leader from this space. Now, we are happy because the results speak for themselves, that I've said. Now, by and large, one of our strongest innovations has been adapting the safe care approach, supported by farm access, into our own primary care networks. Today, no authority to incur expenditure is issued without a dedicated allocation for quality improvement. As a result, maternal health preparedness here in Kolua East Ward has improved from 26% to 54% in 1 year, and for us, that is great progress. That is accountability, and that is leadership. Tuunjonya merwa, ingeni gimora moro maber moti moreka nikech muti yoka une maun malo maloyo. To gimora bela neno kanyo, Madam PS, this community health promoters seem to really have a very soft spot for you. I suspect because you are really down to earth. I saw you interacting with them, dancing with them. Wang ni uro jatela maber pam ni uro gone uro sigala gala. Now, finally, ladies and gentlemen, KQMH-Plus matters a lot. It embeds national quality standards into the routine functioning of primary care networks, linking community services, facilities, referrals, and data into a people-centered system. Kisumu County is proud to be among the first counties in this rollout, and we are ready to lead, to learn, and to deliver. May I thank the Ministry of Health, Madam Principal Secretary, our partners, including Farm Access, and our frontline health workers who make quality real every single day. We reaffirm our commitment as a county to safe, effective, and respectful high-quality care for every patient. On behalf of the people of Kisumu, I welcome the rollout of KQMH-Plus program, and may God bless all of you. And Madam PS, here we also speak French. So if you may just allow me to speak French for 2 minutes. Koro elongire awabiro kagi PS. Tuyena mona duok nuero kamano nekech urwako na wendo maber kabisa. Ung'eyo ne wan wadhi kuonde mang'eny ka jotelo gi obiro. To rwak morwake okolwaka uono aneno kodwa medore matin. Omiyo uyiena aduok nuero kamano. Uyiena mala aduok ero kamano ne kijana iluongo ni Simon and Make Me Smile nikech kumwae kode kaka county. Koso kamano wasetiyo kanyakla kuom ndalo mang'eny. Uyiena mala aduok ero kamano ne wuod dala Greg Ganda. Daktari ni En wuod kolwa ma wabet godo kamiluongo ni cabinet, kama walose weche mag ang'owa mag county. Anyalo wacho maonge luoro ni en wuod kolwa mabede mesa sama itimo ang'owa iwacho weche mag ang'owa mag dongruok, ok weche mag thieth kende, to weche mamoko mag ang'owa bende. Omiyo adwokora erokamano ahinya kuom tich masebedo katimo ang'owa kwatimo kode. Koro kawuono wabiro ka mondo waket ayanga plan ma wawacho kawuono ka. Tadwa ni mondo mi akwa uduto ujokolwa, to bende ng'ata mane kamoro amora e kaunti ma Kisumu ni ka uyie to make sure ni uyudo ID mano mokwongo. Uyudo ang'owa? Kipande. Mar ariyo, kiseyudo kipande, kapo ni ionge go, to indikri e weche mag ang'owa SHA. Nikech kionge SHA to biro ka to chuno nyaka igol pesa e ofukuni, to bende PS osewacho ni ok odwa ni ng'ata mobiro e facility ka kata hospital ka golo pesa ang'owa e ofukune. Sani kaunti ma Kisumu gi namba 7 e weche mag registration mag ang'owa mag SHA. To agombo ni wabed namba 1. Omiyo adwa ni kuwuok ka to ubed jombetre mondo kwanwa ji otim ang'owa, ondikre ang'owa e SHA. Mar ariyo kata mar adek en ni inyalo biro hospital kata ka ok ituo. Ka nitie gimiluongo ni wellness center. Joluo wacho ni chako chon lodhi ajuoga. Koro kibiro kama idhi mipimore tiyudo ka samoro in gi skari, kata in gi tuo mar pressure, kata tuo moro amora ma in go to ithiedhi ang'owa, ithiedhi chon. To ng'ata mayach, mama moro amora marito ang'owa nyayudo nyathi, wabi ang'owa hospital, kik warito oko kocha. Nikech koro sani piny owacho mamalo gi piny owacho ma piny ka oseketo chenro makare ma jowa yudo ang'owa yudo godo thieth. Ne wan kaka oganda akwayo gimuol ahinya mana kaka ne otugi osewacho, kaka Kennedy Ojiambo osewacho, ni wadong'ie ot achiel mar chama mar ang'owa mar ODM. Kuku mar chama kata mar bura mar ODM nosebedo miluongo ni Central Committee moyiero Dr. Oburu Odinga kaka ang'owa, kaka party leader. The governing council moting'o jomoyier kane an achiel kuomgi kene nitie, bende nodhi osidho wachno kane wadhi romo ang'owa e dala mar Mombasa. Nyo wan ka gi mbaka mar oganda mar joluo, to nyo wawinjore ni wadong' e ot achiel, to owinjore bende ni wan wadhi tok Dr. Oburu Odinga, kendo nyo wamiye thuolo ni odhi ogo mbaka gi president mar piny William Samoei Ruto mondo wang'e ni piny owacho midhi chogo manyien wadhi bedo nade. Koso ok kamano, mano e kaka nyowa timo ang'owa, e kaka nyowa winjore. Omiyo kanyo kik ng'ato timo ang'owa, kik ng'ato wuoge. Bende amor ni wacho unuwegi ni tich mosemore Kisumu ka osebedo tich maber. Koso ok kamano, to amba inya tiyo kama nyowa tich maber gang'owa nitie. Koro gima ber kochopo kare otuge, to kichaki gol ng'ama nyatimo maber, tikelo ng'ama pod biro timo ang'owa. Kanyo dong buwinjo maber. With those many remarks, I would like us now to be upstanding because it is time for our chief guest to be able to launch this program officially. Madam PS, nataka tuweke mkono pamoja.